Well, a couple of big stories are making news on the medical front. A strain of the bird flu never detected in humans before is now being blamed for the death of a 59-year-old man in Mexico.
And there could be a combined COVID-19 and flu shot. Moderna announcing positive trial results. But will they be ready for next year's flu season?
Lots to discuss today with UW Health's Dr. Jeff Pothof. Hi, Dr. Pothof. Good to see you.
Hey, guys. Good afternoon.
Let's start with the bird flu story.
Yeah.
This is one person, not in the U.S., it's in Mexico.
Yep.
And this strain is different from the bird flu strain that's affecting our livestock and chickens here. How is it different?
Yeah, so when we talk about influenza, we have these two letters. There's H and there's N, and that's how we describe it. So the bird flu we're seeing in the United States is H5N1. This bird flu is H5N2. H really stands for how is the virus able to infect cells. So, scientists can then kind of categorize influenza strains like that. N is kind of like how contagious will it be. So this one is just a little bit different than the one we saw in the U.S. But for the most part, pretty similar. This individual in Mexico, there's not a lot of details. The interesting thing is they're not sure where this individual picked it up at, but at the same time, it sounds like this person was not a healthy person, maybe would have risk for more severe disease, which looks like what happened in this case.
Gotcha. So obviously here in the States, it is in 9 states in, cows and poultry,
Yep.
but the risk for getting it is still low?
Yeah, risk is really pretty low. We don't see much transmission of bird flu to human beings. I think if you want to look for the exceptions, it would be those people who have just really compromised immune systems. They'd be more likely to contract it and then potentially get more sick. When they've looked at the food supply, when we first started hearing about the bird flu in the United States, they found fragments of the DNA in milk, but not actual virus that could make you sick. So if you're drinking pasteurized milk, no worries at all. And then likewise, consuming beef, consuming poultry, that's all totally fine. You cannot get bird flu that way.
That's very reassuring to hear. And federal officials are monitoring it and keeping an eye on all of this. All right, let's talk about the Moderna trial. It's a phase 3 trial of a combination COVID and flu vaccine in one shot. That sounds promising.
Yeah, I think we're likely to see this, not for this flu season. There's still enough regulatory steps where I think we'll miss the window for this season. But in 2025, I think it's very likely that instead of having to get your flu vaccine and your COVID vaccine separately, you'll get them as one vaccine. The other thing that's really interesting is when they looked at the immune response to this mRNA vaccine, which kind of was birthed out of the pandemic, the immune response was much better than kind of like our old vaccines. So we might not only have a vaccine that covers both COVID and influenza, it might actually work a little bit better than what our vaccines traditionally did.
And the side effects seemed pretty minor as well that they reported.
Yeah, I would say, similar to other vaccines, local kind of irritation, pain in your arm. I think we've all experienced that. For some people, they'll feel a little funny after they get that shot as their immune system gets going. But as far as like any big adverse side effects to this vaccine, not really seeing it.
Do you think it might increase vaccine hesitancy, though? That's been a problem with fatigue since the pandemic.
I think, but if anything, I think now if I know that I could just have to go in once and I can get it all taken care of, I might win some people over. I think there's some people who have just decided vaccines aren't for them, but for those that are looking to get their vaccine, I'm all about one jab instead of 2.
Do you know what the timeline looks like?
I think we'll see it available for next fall. It'll probably get approved sometime like this, or sometime next spring, summer. It'll probably get its final seal of approval, and then it'll be available in pharmacies fall of 2025.
Oh,
all right.
That's very good, yeah.
And for the bird flu, just be careful of raw milk, right?
Unpasteurized milk, like never a good idea for a lot of reasons, but would be one way that you could probably get the bird flu.
Okay. All right, but nothing to worry about at the grocery store.
Nothing.
That's good to hear. Okay, thanks, Dr. Pothof.
Yes.
We'll see you next week.
You bet.